Here we go again. I mean, the story started 15 years ago, pretty much with the first treatments of SARS that we started at Iowa State University. And just to give you a little bit of the timeline, in 2013, we presented in Puerto Rico data on early SARS. In 2018, Minneapolis, we presented data on intermediate SARS. And now in California, we're going to talk about basically advanced SARS, or that typical type of disease that all of us see. In terms of the dogs, I limited dogs only that I've seen in Iowa because I had a chance to follow them and do exactly same replica of examination of the function. But unfortunately, we treated many more dogs, but a lot of these dogs are out of state, and it's very difficult to get information, videos of maze tests, detailed clinical examinations. So unfortunately, we had to focus just on these dogs, which were basically local dogs that I've seen. So in terms of the population, this is just a little bit different compared to your abstract, because in your abstract you have a total of 40 dogs. We added 4 dogs which were SARS dogs but were never treated, but owners keep on coming back for rechecks just because they're concerned about overall general health and the problems that these dogs may have. So that's the reason why basically you can see, in terms of the population, 44 dogs there. So standard clinical evaluations, so every dog had a standard full ophthalmology examination. In terms of the other things, chromatic pupillite reflex testing, ERG, always vision testing with the maze test. So obviously Manus, cotton ball tracking, visual maze test, dim and bright lights, before and after treatment. And we analyzed only data from dogs that we could see for at least one follow-up 3 months or longer after treatment. We had quite a bit of dogs which would show up for rechecks at 1 week, 1 month, and then they would just disappear. So we never know what happened to them. So in terms of the treatment groups, we had 3 groups there, 4 untreated SARS dogs, 2 dogs which received 2 systemic immunosuppressive drugs and a subconjunctival steroid injection, and 38 dogs which were treated with our standard protocol. That's intravitreal IVIG and steroid injection plus systemic immunosuppressive medications, always minimum 2 immunosuppressive medications. Sometimes actually we had dogs which we treated with 3 medications. So again, these are kind of criteria that we established in 2007 for what I personally believe should be a criteria for recognition of the SARS, so we can differentiate between these different autoimmune retinopathies which look similar. So sudden onset of blindness, flat ERG, no red, good, blue, near normal fundus evaluation. And some of these images are from our IOVS publication 2007. So again, 15 years ago, that's the criteria that we tried to establish. Okay, so we are coming to the results section, and I'm going to try to be brief with this results section so we can actually see videos of patients and what are these small things that I always look for when treating these dogs. So in terms of the post-treatment follow-up, basically the follow-up was somewhere around 11.4 months. So minimum 3 months and maximum 120 months. In terms of the group, we had a group A. Those are dogs which didn't receive any treatment. Group B, dogs which received subconjunctival steroid and systemic immunosuppressive medications. And group C, treated with intravitreal IVIG injection and systemic immunosuppression. In group A, obviously no treatment, never had any vision recovery. In group B, unfortunately, these dogs didn't recover any visual behavior. And then we had a group C. So we split the success in terms of the treatment to different categories. So obviously visual navigation skills, or maze, was highly one of the things that we always look in SARS dogs when we treat these patients. Can these dogs navigate in bright light conditions, basically, and avoid objects? So that was around 65.7% in terms of our population. I always tell clients who come from out of state, when they ask about percentage of success, I always tell them 40–45%, because that was for period of time, I mean, kind of the number that we had, but things did change. So basically, these numbers actually surprised me even when I looked at them. In terms of menace response, we had 29% of dogs recovering menace response. And that's that standard test for every ophthalmologist where we say if there's no menace, dog is blind. Well, unfortunately, that's not really the case. You need to check these dogs for the visual navigation skills in a maze. And then we had around 18% of dogs actually recovering cotton ball tracking. So that would be something that you would say if dog can track cotton ball in dim and bright light conditions, that would be considered a sign of the near normal vision. In terms of the complications, the most frequent complication we've seen was subconjunctival hemorrhage post-injection. And that was seen in 76% of the dogs. Why? Because our intravitreal injections are obviously going through that plexus of the veins, so it's not unusual basically to get a little bit of the subconjunctival bleeding, which pretty much resolves within a week. So we did a survival curve analysis here. So red is basically our control. In control, actually, we put the dogs which were not treated and dogs treated with 2 systemic immunosuppressive medications without IVIG. And then our treated group was IVIG treated. So you can see that the difference was highly significant in terms of the comparison between these 2 groups, which kind of is reflected on percentages that you've seen on the previous slide. Okay, so in terms of the complications, a little bit more details. Subconjunctival hemorrhage, that's a major ocular complication, so don't get too frustrated or don't have owners panic about that. That's kind of normal. In terms of systemic complications, soft stool or diarrhea probably most frequently seen, and that was case in almost 20% of dogs. We had one lethality, so one patient died 14 months after treatment, died with a pretty much near normal vision. Owners reported they just died in sleep. They found it next morning. Unfortunately, necropsy was not done, so that was pretty much the most serious complication, if it was complication of the treatment or maybe just a natural occurrence because the dog was quite a bit old at the time. Okay, so now we come to the videos, because whatever I tell you, I mean, when I talk about treatment of SARDS over the years, people look at me like I'm talking about pink elephants walking on a ceiling. So I usually say, okay, I mean, if you will not believe my words, maybe you will believe the videos. So this is Bichon that we've seen. It's a 6-year-old. He had a 3 weeks long history of sudden onset of blindness. And on the bottom, you can actually see what's the treatment that we gave to this dog. I would say this is probably one of the most frequently used treatment combinations that we do these days. And this is a video.
Come on, pup. Come on, pup. Come on, Sophie. Come on. Come on, Sophie. Come on.
So this is video before treatment.
I guess you cannot see. I guess you cannot see.
Okay, obviously it cannot see. That was the comment on the video. So, I mean, when you see a video like this, I mean, pretty much you say, well, okay, I mean, this is potentially dangerous for a dog to do maze test. I mean, especially when dogs are lively like this, I mean, they can kick quite a bit hard. And now, basically, we have that same dog, and this is 9 months post-treatment.
Come on, Sophie. How about you just quickly come here?
Come, Sophie.
Okay, so one of the things that you have to be careful when you're doing maze test, I mean, if there is a technician close to the dog, frequently these dogs will not walk away. They're going to just jump on your tech. Also, you have to be careful with excessive voicing, because some dogs become so good in terms of following the voice sound, so they're going to just basically keep on tracking the voice. So we try to call dog at least once or twice and then stop there and see basically how dog is navigating. But this is that typical recovery of the visual maze navigation skills. So somebody may argue, well, I mean, that's really not a lot. But for owners, it is. I mean, because this dog can independently go in the park, it won't hit in the objects, it can function normally in the yard, in a house. And for majority of our clients, I mean, this is great success. I mean, if it's better than this, great. But this is pretty much something that, that we want to achieve, and it seems that we've been achieving it in quite a bit high percentage of cases. So this is 12-year-old dachshund, so standard poster child for the SARDS, 3 weeks history of sudden onset of blindness. This is video before treatment.
Okay, Annabelle, come on. Come on, pup. Why don't you come up? Just quickly.
So I want you to take a careful look in a dog's head position. So you can see that this dog is using nose quite a bit to sniff down and also to touch the garbage cans with parts of the body and with the nose very, very gently. But one of the things that you will see in a maze test that these dogs are disoriented. So basically they're going to come in the center of the maze, that they're going to go back, even hearing the voice from the other side. I mean, they just won't come. This is the same dog 10 months after treatment.
Come on, Annabelle. Come on. Let's go. Come on. Why don't you come here?
Okay. So one of the things that I would like to mention is this dog actually, I'm going to show you the videos of the cotton ball tracking.
Annabelle, treat.
Oh, there are no treats, just cotton balls, so dog is tracking that. We're going to do it in
Annabelle.
light.
Hey, treat.
So this dog actually had a menace response and cotton ball tracking capability in dim and bright light, but whenever pancreas would flare up, vision would dramatically decline. So it would lose cotton ball tracking activity, but it would still regain the maze test. So if you have a SARDS dog that you are treating, or if you send a SARDS dog to us in Iowa to treat, and dog starts to suddenly lose vision, one of the things that you always have to check is pancreatitis. On Saturday, I have a presentation on dogs with pancreatitis, and you're going to see that basically pancreatitis or subclinical pancreatitis is probably one of the highest systemic diseases or risk factors in the SARDS population. And that's something that we're extremely concerned about, because that's the most frequent reason why we have to stop medications, just because pancreatitis actually can be so bad that they cannot tolerate systemic medications anymore, and that's the end game. Okay, this is basically Bichon freeze, just to make things a little bit shorter. We didn't put the pre-videos. This is just 4 months after initiating treatment.
Okay, Leah, come on. Come on, pup. Come on. Come on. That's good, pup.
Happy day.
Nice.
Leah, come here. Good girl. Good job.
Okay, so again, whenever you have these dogs with a possible subclinical pancreas inflammation, we always keep them on Cerenia permanently. So it's not only 5 days. We basically do it once a day for 10 days, then every other day for 28 days, then after that 3 times a week permanently. I think that's one of the key factors so far, improved success in recent years, I believe, when it comes to these patients. This is dog in a dim light condition, same patient.
Hey, Leah, come on. Come on, pup. Oh, you don't see in the dark. Come on. Come on, let's go home. Come on. Come on. That's good, pup. Oh yeah, you can see in the dark.
Leah.
So it's not unusual to see some of these dogs that obviously are completely blind at night, or they recover some degree of the visual acuity in dim light conditions, but nothing compared to the daylight. And that's what we always explain to the owners. You should count on recovery of day vision, but unfortunately night vision may not ever recover. This is the same dog.
Look what I have. I have treats. Leah. Leah.
So no cotton ball tracking, obviously in dim or bright light. and that's standard behavior. You have a dog which is navigating, but doesn't have a menace at all. So lack of menace or lack of cotton tracking behavior is not a sign that dog is blind. You've seen the videos of this dog navigating in dim and bright light conditions. So that's definitely something that you have to keep in mind. So why these dogs, basically, which do not have a menace or do not have a cotton ball tracking, can see and navigate? This is one of the images from one of the SARDS patients that we did multifocal ERG. And what you can see in a multifocal ERG, that even in a dog which has a completely extinguished full field ERG, there's still parts of the retina which are functioning. And that's a possible explanation why a lot of these dogs which have flat ERGs still have a very good visual navigation skills, or even they can track cotton ball. So a lot of it depends where these ERG signals are located. If they're in area centralis, I mean, you'll have probably better chances of having some vision. So again, a lot of flat ERG theory is limited based on the methodology that we are using, because that flat ERG may not necessarily mean that completely retinal electrical activity is gone. Okay, so this is a 9-year-old Vesti, and this is a video 4 years after initiation of the treatment. And this is video which actually I showed on one of the conferences years ago. Oops. Can we have this video playing for me, please? Yes? No? So it cannot play? Okay, that doesn't matter. So this is the same dog. I apologize for the video. It's here we go.
Come on, Sassy. Come on.
Okay, so this dog is 10 years after treatment. Basically, dog was first diagnosed with SARDS in 2012, was completely blind. In 2019, we did a bilateral cataract surgery because it went blind again because it developed cataracts. So this dog had a cataract surgery. In 2020, it still had a menace response and cotton ball tracking in one of the eyes, but unfortunately, long story short, with the COVID isolation and all the problems that were happening in that period of time, owners had quite a bit of issues getting medications and medicating dog. So they were kind of starting and skipping medication. So at this point, when we saw this dog last time, it still had a visual navigation skills, but unfortunately lost menace and cotton ball tracking capability. So just as conclusions, so we are coming back. SARDS is untreatable disease of unknown etiology? No. That's basically, I mean, hopefully by this time, by 2022, we show that basically this is immune-mediated disease, most likely of autoimmune origin. You have to treat with immunosuppressive medications, and you can have quite a bit of good success in terms of managing and treating these dogs. This small image here is from the Boston 2008, I believe. That's when we showed actually that some SARDS dogs will have that progressive nature. So basically, this is a dog that we initially saw for cataract surgery. Then after basically 16 months, developed blindness in one of the eyes with decrease in ERG, and then pretty much after additional 12 months, developed classical signs of the SARDS. At that time, we really didn't know what exactly this thing is. We didn't treat, and unfortunately, that dog went blind. But again, just as a conclusion of this talk, systemic immunosuppressive medications are a must. Intravitreal IVIG will make huge difference whether a dog will recover vision or not. So that has to be part of the therapy protocol. And pretty much do not let these dogs go blind. A lot of it is early detection. These days in Iowa, every single patient that we see, every single ophthalmology examination, we do chromatic PLRs. Every single one. So we do not use just that white light with a slit lamp. Every single thing gets red and blue. And that's probably secret of our success in picking up so many dogs in earlier stages of the SARDS, when managing and treating them is much, much more effective. If I could basically pass one of the ideas or the main line of this talk, do not wait for these dogs to go completely blind. The moment you see them that they are possibly in that category of early SARDS or intermediate SARDS, your chances for success in terms of treating these dogs will be 90 to 95%. So that's pretty much all that I had. I'll be happy to entertain any questions.
I started recently. I used to do the IgG IV treatment and kind of got off that about the time you did. But also oral lately, I've been doing it more of the oral, and I limit it to dogs that do not have a lot of retinal scarring. So if I'm catching them, that would be the earlier cases. I don't know about you, but once they have a lot of tapetal hyperreflectivity, I think their chance of it working is pretty low, and they don't do well in an obstacle course, so I kind of exclude those dogs. Also, the way I kind of convince owners and convinced myself to do more of these cases, and I have had about a two-third, I don't do as many cases as you, but I've seen enough dogs improve that I'm into treating them now. And what I convinced people again and myself was to give them at least 2-3 weeks of trial treatment. You know, you can always stop it. If you're doing, I do prednisone, azathioprine, that's my comfort zone. I don't do mycophenolate as much. And I don't know, you didn't talk about Imuran, but maybe you don't like it, I don't know. I've had success with that. Baseline blood work, you gotta do it. You gotta repeat at day 10 and day 21 because you can get pretty serious liver issues. Just wondering what you thought about that 2-3 week trial period. The ones that did respond in that time frame, and then we went with the long-term treatment after that. So wanted your opinion if you thought that was long enough too.
Unfortunately, I think that's too short. If you're treating, I would treat for at least 4 months, because that corresponds to the lifespan of your white blood cells. So, and canine white blood cells, like lymphocytes predominantly, live for between 95 and 115 days. So the whole goal is to try to basically control disease sufficiently for these 90 to 115 days until your immunosuppressive medications achieve effect on the bone marrow, so any new cell which is coming less reactive. I would absolutely agree with you that dogs which have so much of the hyperreflectivity generally do not respond well. We had some of them that would respond, but generally that's kind of the relatively poor predictive sign. So.
I just have a quick question, and
Yeah.
maybe I need to ask the person who just asked a question, but I've had trouble getting IVIG because I wanted to try it. And I had contacted you, and when I talked to the company had been acquired, and they had said that you were kind of grandfathered in and how you were getting it. So I need to find out how that person got it.
Okay.
And if anyone else is using it, let me know how you're getting it.
So I'll tell you, I have an extremely capable, sweet-talking manager in my hospital. She can mellow anybody. So basically, but yeah, you're right. I mean, IVIG is one of these medications that frequently will come on the FDA list of the short supply medications. Once when that happens, it will be impossible to get it. That being said, one way to approach it is any human hospital, they use, or any veterinary ear hospital in your environment, if they use IVIG, do not allow them to trash the stuff that they used. Basically, just take that bag and pretty much pull the doses. What we do, we buy that one single dose, we pull it in syringes, like same way old times TPA was done, and we pull 0.25 mLs, and we make 50, 60 syringes and put them in a freezer, and that's it. So that's it. You really do not need to buy new IVIG for every single patient. That's too precious resource for human health to be wasted in the manner for dogs. Yeah, I'm going to give 0.2 mLs of IVIG and trash the whole bottle. That's absolutely, absolutely blasphemy, if I could call it. So just if you get to any IVIG, I recommend Gamma Guard because in my experience I think that one works the best. Just constitute it, draw it, freeze it, and keep it, and you can use it. I mean, for years we did a check activity of the IVIG after like prolonged storage. There was really no difference there. Hey, Brad.
Hey, Sinisa. Hey, thanks for presenting this. Obviously, a controversial topic. I think
really?
one thing, no kidding, right? I think one thing that would be helpful, since your evaluation of return of vision is very subjective, as it is for all of us, I think having a masked observer evaluate the patients following your study would be really, really very much more convincing for people. Clearly, just the evaluation of vision in and of itself is a subjective matter, but certainly having the person who performed the experiments do the evaluation of vision afterwards is even more difficult to deal with. So I think you should consider having a masked observer before and afterwards. I think it would convince a lot more people if we could do that. And your thoughts on that?
Yeah, I know, very good and great idea. And that's actually what we've been in process, collecting videos and then having 3 masked observers who are not aware what was treated and what was not treated and just try to grade it. Obviously, I mean, grading in terms of the nicely organized maze test that people have at university is much easier. Grading dogs running among the garbage can in different clinical environments may be a little bit more different. But yeah, I mean, that's definitely a great point. And that's something that I mean, needs to be done because, I mean, it's one thing what I believe, but I'm biased. So obviously, in order for everybody else to believe, they need to see something more objective in terms how these dogs are graded.
Hi, Sinisa, Freya Moat. So I guess what I would like to point out is the histology that Jen just presented, which is that a decent number of dogs with SARDS have quite well preserved photoreceptor layers despite many years of vision loss. So I personally have come across cases that have spontaneously recovered vision and some cases that never lose vision altogether. How can you be 100% sure with 4 untreated controls that you're actually not just observing an epiphenomenon that's unrelated to your treatment?
Well, I mean, so this is something that we kind of tried to push. Like 15 years ago, I did a small inquiry among our colleagues at that time, and just asked, okay, how many of you see SARDS dogs like per year? And then people will usually say somewhere between 10, 15 to 20. Said, how many of you are treating dogs? And I said, well, nobody. And then how many of you have seen dogs which spontaneously recovered vision? I think there were a couple of people who mentioned that, but the vast majority of these dogs, obviously, they were never recovered vision. I absolutely agree with you, but I mean, I live in clinical reality. It means that when I diagnose a dog with a SARDS, I offer full treatment. I explain consequences. In vast majority of situations, these people will never come back. So there is no way, basically, I mean, to follow them, because I mean they do not come back to their local veterinarian for mandatory recommended lab works that we recommend for these dogs, regardless whether they're treated or not. So yeah, I mean, I would like for things to be nicely organized, like it should be an ideal world, but some of these things, just like, yeah, you have to work with what you have. I mean, so.
So have you ever taken a case off treatment and noticed a sudden discontinuation of vision?
The moment you take them off the meds, they're done.
And have you maze tested those dogs?
Yes, I did.
So maybe you should be analyzing those data too.
No, I mean, so here's the thing. I'll tell you the classical scenario. We have owner fatigue, where basically people stop giving medications because they just say, I cannot do 5 medications anymore. That's number one. Number two, basically, we have dogs which stop tolerating medications. So they have continuous problems with diarrhea, sporadic vomiting, and stuff like that. And owners ask, well, can we stop medications? I said, yeah. We usually ask them to record a maze test for these dogs so we can take a look at them. But unfortunately, I mean, sometimes that happens, sometimes does not. So again, I mean, a lot of these dogs just fall off the radar. So, yes.
Hi, Christina K. So I do have a question. So are we on these immunosuppressives lifelong? And if so, have you seen any like detrimental effects from having that? Because Dr. Brown, in Orange Park, we were thinking about doing your procedure as well, but that's one of the things we were worried about, having a patient on all these immunosuppressives.
So in 2010, we did a molecular analysis of tissue. Actually, that was done by our colleagues in Heidelberg in Germany. And when they did the map of immune reaction, that immune reaction was most similar to the graft versus host disease and organ transplant rejection. So pretty much that's how you have to think about disease. This is most likely organ transplant rejection type of the reaction, and that's how you have to treat them. Moment you start cutting down on meds, that's the moment the vision will start to decline or will be completely gone, and it will be extremely difficult to get them back. Are there side effects? Yeah, I mean, those are immunosuppressive medications. You have to carefully monitor liver function. You have to carefully monitor kidney function. You have to carefully look for any other issues. But generally, they seem to be well tolerated unless they have pancreatitis. In our study population or our clinical population, every third dog will eventually have pancreatitis or has it already at the time of diagnosis. Once when they go in a more aggressive form of pancreatitis, all these medications will not be tolerated anymore. So,
Thank you.
I just want to make a comment that our practice has been closely looking at this as well. And Sinisa, we looked at 22 cases a few years ago and compared IVIG or no IVIG, and there's no difference in recovery of vision. There's a pretty good recovery of vision, and the fact that we're debating whether these dogs are visual or not is actually insane to me, that an ophthalmologist can't assess whether a dog can see or cannot see after this treatment, because this is quite profound. But another point I want to make is that the incidence of side effects is also quite profound. In fact, I find myself hardly ever treating this again because of we've had several deaths related to immunosuppression, dual immunosuppression. We use an internist that carefully manages these cases as well. The incidence of diarrhea is very high. And of the 22 patients that we have actually closely followed, we've had 3 dogs actually maintain vision for over 3 years, and all have had to cut down the immunosuppression because of drop in white cell count, and all 3 of them, 2 of the 3 of them have lost vision, 1 of them in 1 eye. So I totally agree with you. Got to keep up these high doses of immunosuppression, and it is not benign therapy at all.
yeah, no, thanks. And we spoke about it like over the years. Again, my personal impression or clinical data, without IVIG, we just do not tend to do that well. Again, in terms of systemic complications, one of the things that people need to appreciate, different regionality lead to different outcomes sometimes. I mean, it may be same disease, but dogs actually from different geographical areas may respond differently. For us, the major concern is pancreatitis, so that's usually the deal breaker where medications will have to stop. Any other questions? All right, cool. Thank you very much.